Bismillah. Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Muhammad Zulharizi, and today my group will be presenting about MRI. If you want to know more about MRI, like how does it operate and so on, you need to stay tuned until the end of this presentation. Okay, this is the list of contents of our presentation. Let's take a look at it, and I will be passing on this presentation to Brother Zulnazmi. Thank you, Zulharizi. On to the first discussion on what is MRI. MRI stands for Magnetic Resonance Imaging. It is a medical imaging technique that uses strong magnetic fields and radio waves to create detailed image of organs and tissues inside the body. To summarize, MRI provides valuable diagnostic information and commonly used to detect and diagnose under various medical conditions. This is a more clearer picture of how MRI looks.
Thank you, Brother Zulnazmi. So now that we know what an MRI machine is, why do we use one? So first of all, MRI machines, they provide a very detailed visualization of the insides of our bodies. So it is excellent for soft tissue contrast, which means that we can see organs, muscles, tendons, ligaments, and the brain more detailed than if we used an X-ray machine or a CT scan machine. So this means that doctors can diagnose our health conditions that are related to our blood vessels, our spinal cord, much better and much more precisely. The second thing is, MRI machines, they do not emit ionizing radiation like X-ray machines and CT scans. So for patients that are undergoing this imaging process, like repeated times, and for long-term patients, they will be in less risk of contracting a disease that's related to the radiation, such as cancer and so on. Although MRI machines are good, sometimes it is much better to use X-ray machines and CT scans. This is because they are much quicker and more hospitals have them because they are much smaller and does not require a lot of horsepower to run. To help us understand better why we use MRI machines, I asked the top radiologist from the General Hospital of Seberanjaya, Penang, and this is what she had to say. My first question to you regarding MRI is, why do we use MRI machines over X-rays or CT scans in certain cases?
Body imaging, there are many types of energy that we use to produce body image. We can use X-ray, we can use sound wave, or we can use magnetic power to get the body image. So depends on the property of the energy that we use, we can produce different types of images, and we can focus at different types of body tissue. For example, if we use radiation as the energy to produce body image, we are using the radiation property, which type of tissue that the radiation can penetrate. We use this different property to produce image. So X-ray is best to see bone rather than soft tissue. Okay?
Okay.
For ultrasound, for sound wave, we use the reflecting property. It will get reflected by air. So structures inside our body which contains air cannot be imaged easily by ultrasound. So for MRI is the most difficult one, the most high technology, because it uses magnetic power which interact with our body at molecule level. We are using the hydrogen ion inside our body. Interaction between magnetic power and hydrogen ion in our body, the interaction between those two to produce body image. we can characterize the tissue.
Mm.
From MRI, we are not only seeing the organs, but we can see tissue. We can differentiate muscle, we can differentiate fat, we can differentiate calcium, we can differentiate blood, we can differentiate air, we can differentiate everything. Okay?
Okay.
To correlate with the clinical question,
Mm-hmm.
it depends on our clinical question.
Mm.
If we want to see fracture of the bone,
Mm.
we will use radiation, either X-ray or CT.
Mm.
Okay.
Okay.
If we want to further characterize the soft tissue component of the disease, we will use MRI. So it depends on clinical question.
Okay. Thank you again, doctor, for your time and Assalamualaikum warahmatullahi wabarakatuh.
Alright, on to the third discussion on when is MRI performed. MRI is used when other imaging techniques have not provided a clear picture of what is happening inside the body. Other imaging technique, for instance, is X-ray and CT scan. X-ray and CT scan fall short when compared to MRI. MRI provide a clearer picture on image of ligament, muscle and tendon. Therefore, it is more often for doctors to use MRI for knee and shoulder injury. It can be done on an inpatient or outpatient basis and can take anywhere from 15 to 2 hours depending on the part of the body being imaged. Inpatient involve overnight staying in medical facilities, while outpatient on the other hand does not require overnight stays, but the doctors allow the patient to return home after receiving the necessary medical services.
Okay, so next will be my turn to present. My name is Mutsanna, and I will be presenting for the next two slides, which is for the number 4, who, and number 5, where. Okay, for the number 4, who performs MRI? So basically, MRI scans are usually carried out by a radiology technologist who operates the scanner machine. A radiologist is a medical doctor specialized in interpreting medical images, reads and interprets the results. However, MRI is also used by neurologists, orthopedic surgeons, oncologists, cardiologists, gastroenterologists, and among other healthcare professionals. For your information, neurologist uses MRI machine to assess the structure and function of the brains. Orthopedic uses MRI machine to evaluate musculoskeletal structure such as bones. Okay, these are just a few examples of the healthcare professionals who use MRI in their practice. The versatility of MRI makes it a valuable tool across various medical specialties for diagnostic purposes, treatment, planning, and monitoring of patient. Okay, that's for the number 4. Moving on to the number 5. Where is MRI performed? So basically, magnetic resonance imaging, or we refer it as MRI for now, is typically performed in a specialized medical facility such as a hospital or an imaging center. These facilities have dedicated MRI machine and trained healthcare professionals to operate the equipment and interpret the results. However, in some cases, smaller clinics or medical offices may also have MRI machines available there. Okay, that's all for me.
MRI this, MRI that, but how does it actually works? For your information, MRI will produce two main elements, which is a strong magnetic field and radio wave.
Before we go any further, I need to tell you something. The magnetic field that an MRI machine makes is 1.5 Tesla. To put that into perspective, the Earth's magnetic field is only 0.00005 Tesla. When you take that into account, The magnetic field, the MRI, compared to the magnetic field of the Earth, 30,000 times stronger. So keep that in mind when you listen to what Zulharizi has to say next.
The strong magnetic field will align the protons of the body hydrogen atom from like this, and it will align it to like this, and then the radio wave will disrupt this alignment back to where it was, and when it is moving to their original location, it will produce it will emit a radio frequency signal that will be translated into an image of the body's internal structure by the machine. So it is actually like a printer but for human, as they scan before they print the result. I hope this explanation give you the understanding of how does MRI works.
Overall, from an Islamic perspective, the invention and the usage of MRI machines totally aligns with Islamic values. For example, the preservation of life. Islam places great emphasis on the preservation and the protection of human life. The usage of MRI machines allows us to detect diseases in their early stages, so we can prevent the diseases instead of curing it. As the saying goes, prevention is better than cure. So, if you can see on the next slide, the Prophet ﷺ said there are two blessings that people are deceived into losing, which is health and free time. So, if we use the MRI machines on our yearly checkup or yearly health checkup, we are able to keep our health in check, and we are able to fulfill the right of Allah subhanahu wa ta'ala that we are keeping our body healthy and mantap condition. Alright.
Okay, as it is the law of nature that every meeting must have an end, and now we have reached the end of this presentation. I thank all of you for listening to our presentation until the end. I hope the knowledge that we shared will benefit you in a way or another. Maybe some of us will be the operator of this MRI machine, who knows? As the saying goes, the future is the mystery. Assalamualaikum warahmatullahi ta'ala wabarakatuh.
So, where I look?
I hope this is the last take, guys. It is already 2 p.m.
Warahmatullahi wabarakatuh.